Hi, this is Eric Rosenberg, MedicareNationwide.com. Today we're going to talk about the Plan N. We're going to talk about how the Plan N came to be such a popular plan. What was the evolution of that? It started with Plan F, went to Plan G, and now here we are talking about Plan N and why maybe you should consider it, especially if you've been on a plan for a long time and your rate has kept going up. We'll also touch on the high deductible Plan G. We already have a video about that, but I plan on doing a video. My business partner Jackson Edwards came out with a video on the high deductible Plan G, but I plan to do another video on that, especially if this video gets a lot of likes. I'm thinking I'm going to do that one shortly after. So be sure to like this video if you found it helpful and share it and comment so that way I can be encouraged to keep doing this for you. All right, so high deductible Plan G, that is Plan G with a deductible where you lower your premium, and we will get into that. And then we'll touch on Medicare Advantage as well, but I will be doing another video that will compare Medicare Advantage to what a Medicare supplement plan is. So we're going to give, this video is going to be focused on Plan N, and I'm going to share where the Plan N fits into all these other plans, and I'll go in more detail on the other plans in another video. Let's begin. So you get Part A, that's the hospital. You get Part B, that's the medical through the government. Now, it doesn't cover everything. Part A, you still have out-of-pocket costs, $1,600 deductible, co-payments in the hospital. Part B, you still owe 20%. You're paying $164.90 a month just to get Part B. You have holes. You have gaps in your coverage. That's why you get a Medicare supplement or a Medigap plan to cover those holes. So before 2020, one of the most popular plans was Plan F. Plan F covered Part A, Part B. So after Medicare pays first, and then after Medicare pays, the secondary insurance company, the Medigap plan, Plan F, covered everything. So you'd look at your bill and be like, oh, Medicare paid first as my primary insurance, and then my secondary paid after that and covered the 20% and all the hospital costs. Like, good deal. And then you told all your friends, go get Plan F. Plan F's the best. Well, in 2015, Congress voted to discontinue Plan F for newly eligible Medicare recipients in 2020. And so the next best plan, I guess you could say, the most comprehensive plan that covered the most was Plan G. And Plan G only had one minor difference, and that was the Part B deductible. Part B deductible for the medical was $226, which means you need to pay your provider $226 before Medicare pays, and then the secondary covers the remaining amount. That was the only difference. But what was happening was Plan F kept going up in price, and I can explain that a little bit later, more so than Plan G. So people would pay their deductible and be paying so much less in premium that they would be saving all this money. And so there was this big shift from Plan F to Plan G, not only because it was discontinued, but the people that could still keep their Plan F moved to Plan G because they were saving so much money, and it made sense. You just pay your deductible and save money in the premium. Now, Plan N is now becoming the new Plan G in a way. It's becoming, the new conversion is from F to G to N. And why? The reason why is because the rates for Plan G are going up a lot because now in the something called guaranteed issue. Guaranteed issue means an insurance company has to accept adverse risk. Before, Plan F had to assume all this adverse risk. And so there was more health questions to get on Plan G and the rate was more stable. Now Plan N has become that. So Plan N also attracts more healthy people because it's a little bit less coverage where you're responsible for, the main difference is you're responsible for co-payments of up to $20 for office visits. So you adopt that responsibility, but you really are able to lower your insurance premium. And you're pooled together with a lot more healthy people, generally speaking. It's not always the case, but typically healthier people don't have as much of a problem paying that Plan N co-payment versus people who have a lot of health issues. They either don't qualify for Plan N or they don't want to make those co-payments because they're already going to the doctors a lot and getting co-payments and it's being covered. So Plan N is more suitable for people who are good health risks, generally speaking. And a lot of people who turn 65, they don't have to answer health questions. And so you could still save money and pay and maybe pay a couple co-payments for Plan N and do better than getting the plan where it covers everything for Plan G. But maybe you worry that one day you're going to have a lot of physical therapy and that could be a lot of co-payments and you don't want to have to deal with that. And so you would prefer to pay a little bit more for the insurance and go with Plan G. Not a one-size-fits-all. That's not how I prescribe anything to people. It depends on your budget, depends on your health, depends on what your long-term goals are. Just kind of what I'm like touching upon now. Now, the high deductible Plan G is another plan. And the way that one works is it's Plan G with a deductible, high deductible, $2,700. Medicare still pays as primary, so it'll still pay the 80% during that deductible period. And, maybe you save a good amount of money in insurance premium by adopting that deductible. But when we're doing the analysis between the high deductible plan, the Plan G, the Plan N, in some states, the Plan N could be $200 a month. And the high deductible could be $50 a month. And you do the math, and you're like, oh, wow, I think I'd rather take the deductible, saving a lot of money here, especially if you're healthy, versus, let's say, it's $80 a month for Plan N, and the high deductible is $50 a month. And you're going to take a $2,700 deductible for saving $30 a month? The math doesn't make sense. So it's not one plan is right, obviously. Does the math make sense according to where you live, what kind of quote you're provided? And we do all that kind of assessment here. So if you were to set an appointment with me, we'd take a look at these plans. I'd be able to look at the different insurance companies and be like, okay, in your state, for example, let's say Allstate. Allstate offers a 10% discount if you pay annually. Oh, you have somebody else on the plan that you're your spouse. Okay, I can give you a 7% discount, 10% discount. It all depends on what state you are. So when people say, oh, just email me a quote. Email me a quote. I hear that all the time. It's like, well, I can't. I have to talk to you. I have to know, are you a smoker? What if you're going through underwriting? What's your height and weight? That matters. So getting the right price, figuring out what the plan that's right for you really does take a conversation. And I usually just send people my calendar. We'll find a time that's right for you. Even if you're not ready today, we'll get you on the calendar when it's time, even if you want to do something 3 months before you turn 65, let's say. Right on the calendar. And we'll go through everything. What does Part A cost? What does Part B cost? The high deductible plan, it's really worth a lot to consider it because you live in New York and prices are expensive there, or maybe you live in Iowa and, you really should just go Plan G because, it's so cheap and you don't have to worry about co-payments. And down the road, if it goes up, you could always, and you're healthy, you could switch to Plan N or switch to high deductible. So we would strategize. We've taken all that into consideration. Now, I said I was going to touch on the on the Advantage plan. So I was going to talk about the Advantage plans. And I'm going to do a whole video on this as well. But so the Advantage plans, a lot of people, they're like, oh, my premium went up. I'm just going to drop it. I don't want to deal with this. So I'm going to drop my insurance premium that buys me coverage, and I'm going to take my chances with the Medicare Advantage plan, pay nothing, get some dental, get some vision, and see how it goes. Well, how's it going to go? You're paying nothing for insurance. So guess what? What's your coverage going to be like? Okay, so you might have heard a story. Oh, I got an uncle who had a heart attack on a Medicare Advantage plan. He only had a $500 copayment. Okay, that's good. And some people have a good experience. Maybe they live in a city where there's a lot of doctors. But some people live in the middle of nowhere. They can't find a doctor on these Medicare Advantage plans. Or maybe, they just thought everything was going fine for years. And, okay, I didn't realize there's, no good pulmonologists on this plan. Okay, so because when you're in a Medicare Advantage plan, you're restricted to a network. When you're with a Medicare plan, with a Plan G, Plan F, Plan N, high deductible Plan G, you're with Medicare. You can go anywhere. Medicare will approve you. Well, assuming they accept Medicare. But even if they don't, you can send the bill to Medicare and get paid by Medicare and the secondary. You can get reimbursed up to the Medicare approved rate, and then you can pay the doctor the difference. You can't do that on Medicare Advantage plan because you're not in the network. You can't bill Medicare for reimbursement because you've given up Medicare as your primary insurance if you go into a Medicare Advantage. So a lot of people, they don't realize that they have more choices than just Plan G and a Medicare Advantage plan. So a Medicare Advantage plan attracts a lot of people for this reason. That's why doing a video on Plan N, to me, is important for the consumers and the public to know that they don't have to give up Medicare if their premium's going up. They can just lower their premium, read shop, talk to someone like myself or talk to me, and I'll be able to find you the right plan. And again, you can go to MedicareNationwide.com. We got reviews. Go to Google. You can look at all those reviews. We got a public face. And you know that we're not just someone that knocked on your door and has been doing this a little shorter than you've been doing it now. So I hope this video has helped give you kind of a general conceptual idea to run the real data, the real numbers. I can do that for you. Just reach out to me. We can get on my calendar, give me a call, and we'll walk through that. I've been doing this for a long time. I started in 2010. I became a certified financial planner and got into Medicare as my specialty. I got a lot of designations. I love my job. I take my job seriously. I like helping seniors find the right plan. And I really like putting others first, sincerely. And I really look forward to meeting everybody all my clients, having good rapport, staying in touch, letting you know your choices as they change. I'm licensed in 48 states plus DC. So if you were ever to move, I could help you. I know each state's market and how it works. So don't be shy. Call me up. Look at the description for contact information and more videos. And thank you for staying all the way to the end. I really appreciate it. And I know that I'll be able to help you. Thanks.